watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome to Medical Talk. I'm Betty LaMarr. Today we're talking about what you need to know about infectious diseases in our community with Dr. Animalu. Well, thank you for joining me today. You know, I have been really waiting to have you on this stage with me. Now, to get this started, I want you to tell our viewers who you are, because I hear that you are an expert at what you do.
Absolutely. Thank you, Betty, for having me. My name is Dr. Animalu, and I am an infectious disease specialist out of Methodist University Hospital and a professor of medicine, Division of Infectious Diseases at UT College of Medicine.
Okay, now, I always ask the doctors when they join me, you know, why is your passion, or why was your passion to go into your field of study, infectious diseases? I'm always curious about that.
Yeah, so as you know, infectious disease is a specialty that basically deals with managing or treating various types of infections. It could be bacterial, it could be viruses, it could be fungal. I grew up in Africa, and I did experience a lot of infections, and most of them were childhood infections. And as a child, I was really curious, like I could not understand why there was so much illnesses, especially infections. And so that was where my curiosity came from. And I knew I wanted to become a doctor. And after all that vigorous training, I still wanted to become an infectious disease specialist. So it's something that I'm very passionate about, you know, given my upbringing.
Okay, so I know that you're, when I hear about you, the HIV always comes up. Like, you want someone to talk about HIV, then this is your doctor. So why HIV? Why is that such a passion for you? Does it go back to your roots as well, to Africa?
So not necessarily. So, you know, during my course of training in the medical field, HIV was something that was thought to be a taboo. And it kind of, I was very curious, because usually in those days when, you know, you hear HIV, people run in the opposite direction.
Yes.
And one thing I would like to let our audience know today is that it's no longer that. HIV is an infection that, you know, you could get through various methods that I'm going to talk about in a second. And it's something, even though there's no cure, but it's something that could be managed. So we see HIV now, which stands for human immunodeficiency virus, as an infection that you can control with the right medications. The same way people take medications for diabetes, for hypertension, for high cholesterol, for asthma, you get to take medications for HIV, and you can live your normal life like everybody else.
Okay, so we're going to really get into that in more detail, but just for right now, I would like to know, what is the prevalence in our community of HIV? Is it still bad? Because, you know, you don't hear about it, you know, people just don't talk about it like they did before medicines, you know, came on the scene.
So we have a major issue at the moment. So Memphis, our dear city, ranks #2 in the entire country for the most newly diagnosed cases of HIV. And what is shocking is that it's affecting our younger populations, our teenagers, from the range of 14 years old to 19 up until 21 years old. So it is scary and it is devastating.
Okay, 14 years old. So where is this coming from? Because the only way, you know, in my generation, you know, we always connected it with, you know, intimacy.
Absolutely.
So how are 14-year-olds in that age group contracting HIV?
Exactly. So we all wonder about that. But what this is telling us, obviously, because the numbers don't lie, is that Our younger ones are having what we call unprotected sexual intercourse.
Okay.
I mean, there are many ways you can, pick up HIV. Number one would be through intimacy, sexual, unprotected sexual intercourse. You can have other sources like blood transfusion, but these days, blood products undergo very rigorous testing before they are transfused. And then you have what we call like vertical transmission, where a mother who has HIV that was uncontrolled and gives birth to a baby and can transmit that infection to the baby. Then for the healthcare workers, you can have like what we call the needle stick injuries, where you get a needle stick from maybe an infected person. And then another population would be our intravenous drug users. So if you're sharing needles, or people that perhaps, have to take, let's say, insulin or whatever, and you're sharing needles with people. So those would be the major ways of transmitting HIV. But in our teenage population here, it's pointing more towards unprotected sexual intercourse.
Oh. Well, let me ask you this, because I've had this conversation before in this talking about HIV. Children, we're going back to just the thought of that. How do you know, or how does a child know if they have HIV? Do they just end up getting sick, coming to the hospital? What does that look like?
So that is why HIV for most part is asymptomatic. So what it means is that you might not know. It's, so what happens is that the initial infection, you might have what seems like to be like flu-like illness, and then it goes away, and then you're fine, right? And so most people will be like, oh, I probably had the flu, and that's it. So it doesn't have any specific symptoms, and that's why we are pushing for people to be tested. So for our younger generations, for older ones like us, if you are sexually active, you need to know your status.
Yes.
Especially, if you are not certain of the person that you are involved with, everybody needs to get tested. That's the only way you can know. There are times where you become symptomatic, meaning you start, having symptoms or falling sick, would be the end stage of it, which is called the AIDS.
Oh,
yeah.
That's when it's really...
Yeah.
Yeah.
Okay.
Well, I had a family member, he was 31 years old, and he passed away with AIDS. And I always say that if you had an enemy, that is one of those things I wouldn't even wish on my enemy, because that was back when there wasn't medication for it, and you just had to see them. And I always tell people, if you see somebody really that pass away due to AIDS, you would do everything in this world you can not to, if any way possible, not to be infected, because it was really a really difficult ending for him. So this is what we're going to do. We're going to go to a break, and I took me back to my nephew. But we're going to take a break, and when we come back, we're going to go into more infectious diseases that the community need to know about. That we don't know everything. Normally we wait until things hit the news, okay? All right. Stay tuned for more medical talk on GHS-TV.
The reason I chose art is because I love many aspects of art, such as the fact of being able to draw what you like or draw from your imagination.
Art does open the horizon of the mind. You have to have a certain type of mindset and mind to be an artist.
I think the arts are really important because they provide students with that safe space. They provide them a space where they can express themselves, they can be who they really want to be.
I've always been interested in art, even though I haven't always been good at it. And I think it's like my primary form of self-expression. I feel safest in an art classroom. I like the community, and I like to experiment with other mediums.
At Germantown High School, we offer a variety of art classes. We have our introductory art classes, Art 1, Art 1 Honors. We also have the AP Art and the International Baccalaureate Art program as well.
When it comes to students who feel like they cannot draw or do any kind of visual art, that's my territory. They often come in saying, Mr. Weddle, I can't do this. And I say, relax, you're in the right area.
I want them to learn new techniques, try new media, develop skills that they're proud of in the arts.
I think the idea of being able to present something, an idea, their own work, a concept, those are exercises that we do in our class every day.
It's really fun because you get to really do things at your own speed and you get to really experiment with a lot of things.
It's a very eye-opener for me. It helped me determine what I wanted to do in life. It helped me a lot, what I wanted to major in, how I wanted to do it, what plan I wanted to follow.
Don't give up. Always keep persevering, always keep trying, and keep doing, because you'll always learn something new and you'll find something else that you want to do. And when you find something you want to do and you love to do it, continue doing it and continue finding new things to love about it.
For more information about the Kappa program, visit ghskappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome back to Medical Talk. We're talking about infectious diseases in the Mid-South communities. Okay, now, I learned a lot in that first segment, and I know there's a lot more to learn. So we covered HIV. We're gonna go, back and forth with that, but let's talk about since you're an expert in this, let's talk about some other diseases that we may not hear about a lot, but they're out here.
So another disease to consider would be syphilis.
It's back, or has it never went away?
So we thought we were on the path to complete eradication, but it's done a rapid turnaround, so we are back to syphilis areas again. Yeah. So syphilis, just like HIV, would be, considered a sexually transmitted infection. And it was rampant, in those days. And there was a lot of effort by the government, the CDC, the World Health Organization, UNICEF. People came to, do everything possible to have this infection eradicated, but it's made a major comeback. Mm-hmm. So just the same way we have seen an increase in HIV, especially in our community here in Memphis, we've also seen a major rise in syphilis amongst our members here. And so it kind of boils down to the same thing. What do we do? So right now, we are not only worried about HIV, we are worried about syphilis, we are worried about herpes. There's so much, to talk about, but part of what we do is to also educate our communities to kind of watch out for these things.
So I know this is probably a question that I just want to ask because you're an expert here. Why is it always somehow connected with sexual activity? Is it because of body fluids, or is just something that it's just a sin in this one way, the consequences of it? So seriously, why?
Okay, so those will be considered, so the infections I just mentioned will fall under the class of STIs, that sexually transmitted. Okay. But I promise you, we have a whole lot of infections that has nothing to do with
But in our community, we're talking about these because we need to bring awareness.
Yes, and we are seeing this amongst our younger generation. And as a parent, I have kids in college, I have kids in high school, and that's the age range that is worse right now. And also, when you talk about race, it's worse in the African American community. So it's something that's very passionate, to me. And I feel like part of what we're seeing is lack of education. I took the liberty of talking to a few high school kids, and I just kind of wanted to see what they knew about HIV. I say, what do you do? And they were like, you take antibiotics. And I almost passed out. No, man, you cannot take antibiotics. It's a virus, not a bacterial. So it became very clear to me that our communities are not well informed, well educated, and I feel it's part of what we do to kind of steer them in the right direction.
So what do you think would be a good approach to bring awareness to young people, especially being that they're being affected by it, right, in high numbers? So what do you think? What do you think we can do as a community or the media to help young people? Do they not have health in schools or where they can learn, or have someone like you to come in and do some kind of outreach to them? Because this is important.
Absolutely.
It's a life or death here.
Yeah, so it's a life or death situation here. And part of what we're doing right now is the major hospitals or healthcare providers in this city. I work for Methodist and for UT, and we are all coming together to work with the health department, Shelby County Health Department, and see what we can do. We are more than happy to go into schools and educate our young kids. Because, like I said, part of what we're seeing is lack of education or misinformation. So to be able to create this awareness, because this is something that nobody thinks about, till you find yourself in the hospital, and then, the doctors are like, oh, okay, you're HIV positive. You're like, wait, how? How did this happen?
Right.
So part of it would be to also, create that awareness. We need to keep that going. We need to let our people know that this thing exists and it is hitting our community the most. I mean, we are second in the entire country. Like that's not funny at all.
No. But why? I mean, race is always, when you talk about diabetes, and this shows like race, it's like we're always at a higher percentage, if you will, or prevalence of. So what is it about the Black community, if you will, or our community at large? Is it back to the lack of education or getting misinformation? I mean, why?
Part of what I see, so as you know, I take care of HIV patients. I'm a HIV specialist, and
Okay.
I love what I do. And so I do take care of our HIV positive patients in the hospital setting. And a lot of times what I've noticed, and when I sit down and talk with these patients, is the stigma that is associated with this infection, especially in the Black communities.
Okay.
People see it as such a horrible thing or such a bad thing, because I've had patients who did not want their family members to know, and then we have to make sure that they are safe, like their families do not know. But so one thing I would like to let people know is that there's no shame in it.
Okay.
There's so much bad stigma associated with this, and people would rather die than let the public know, or perhaps let their families know. So I want to use this media and let them know that it's okay. There's treatment out there.
Yes.
It wasn't like in the 80s, perhaps, when you talked about a family member that passed away. It was considered something of shame, like bringing shame to the family.
Yes, he was hiding it from us, and by the time he realized that, there was no judgment coming from us, he was almost in
AIDS.
He was really bad, and then he realized, oh wow, this is my family, and they love me regardless.
Yes.
So, but anyway, we're gonna take another quick break so we can learn more about what's going on at GHS-TV, and we'll be right back.
Absolutely.
And this is so good. Watch this space for more medical talk.
So my belief is that band is the life of the school. If the band's not fun, the school's not fun. 2, breathe, and.
Germantown High School Band is unique because we do marching, we do concert. Our director, Jeremy Thompson, brings an energy to this band that's very unique from all the other schools in Memphis.
We offer several special groups. We have 2 percussion classes that are very unique. They operate outside the general band program. They do their totally own thing. We also have a jazz band that functions on its own. The great thing about the jazz band program is that it's mostly student-led.
Jazz music teaches you how to move with agility and precision, while classical music teaches you how to play with feeling and emotion.
We have 2 concert band classes. We have the Varsity Winds, that's our highest performance ensemble, that's audition, and that's where our Kappa students reside in that higher ensemble. We have an intermediate band class as well.
Marching band has probably been the most enjoyable experience for me.
We had such a fun time at the football games, getting to play our music and share our music.
We try to get out there and make sure that the team is happy, the coaches are happy, and that for the most part, the student body is happy.
I enjoyed band a lot. I loved being in the class.
Play D with that fingering.
It's very energetic, it's very intense, and I feel like that fits our atmosphere and our community in the band.
One major thing we push in band is just being a better person, being able to see something through to the end, cooperation, problem solving, all those lifelong skills you need as a young adult and into your future adulthood.
If you're ever hesitant about learning an instrument or think it's really hard to do, yes, it is, but don't be as scared. There in this program, you will learn how to play that instrument and you will learn how to develop into a better person. And I think that the band program will be great for you to join.
For more information about the Kappa program, visit ghskappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
Thanks for tuning in. This is Medical Talk, and we're having a candid conversation about infectious diseases. So, okay, now you have my full attention, okay? And I'm learning something, and I hope everyone else out there is learning something, because this is important. You know, this is about health and wellness. This is about life and death, right? And, you know, you need to know about these diseases, because if you don't know, you can't protect yourself, right? And I just couldn't imagine waking up one day and knowing that I could have done something to keep me from being in the bed, you know, like my nephew was, just pretty much bedridden. And you know what I would never forget, like I said earlier, if you ever see somebody in that condition, it make you really like pay attention, because you actually witnessed what you never want to be you in your whole life.
Absolutely.
You know, and so going back to HIV really quickly, because like you said, it is so prevalent here. Do they still get AIDS? They still get sick like my nephew did back in the 80s?
So absolutely. So HIV has a course, a clinical course it follows. So AIDS, which is acquired immunodeficiency syndrome, is the end part of the HIV infection.
Oh.
So it basically comes in like 3 stages. The acute infection, which is, just a few weeks after, you acquire the infection.
Okay.
Then you have a chronic cause, which will run for years, And then AIDS is the very last part. Mind you that how this infection works is by attacking your body immune system, okay? So what happens is that when it eats up your body immune system, those cells in our body that helps us fight infection, those tiny infections that me and you can ward off becomes a problem, okay? And so that's usually what will kill in HIV. So yes, we see AIDS on a regular basis. Once you're taking your medications, you're on the right medications, you will not progress to AIDS. It just becomes like a chronic infection. So what we see in the hospital will be somebody that perhaps did not even know they had HIV or was not taking their medications for whatever reason, and then they come in with one of these, we call it opportunistic infections. So they take opportunity of the fact that your body is not healthy, your body is no longer able to fight, and that's what kills in HIV. So that end part, the AIDS, will lead to death.
Oh, well, that makes sense then. When you was speaking of that, it reminded me of COVID, because I always say it seemed like COVID attacked people that already are too weak, their bodies, for whatever reason, immune system is too weak to fight it, and it sort of kind of take you down. And so speaking of that, I'm so happy I have an expert with me today. So speaking of that, what is COVID looking like coming this year? Because I hear it's on the rise, not as it was, of course, thank God. But, and you are, what's it say? I think you said a little while ago, people perish or whatever for lack of knowledge. Okay, so give us a little bit of knowledge about what we can expect from COVID this time around.
So it's on the rise, like you rightly said, and we are going into the cold, days and the cold months. So usually you're going to see all those viruses, begin to come up again. Not just COVID, influenza, flu, A and B, RSV, respiratory syncytial viruses. So these are the viruses we're all going to see, this period, especially in the winter area. So COVID, as you can imagine, it's not as bad as it was, 2019, 2020. It was beyond devastating. So now, all we're saying is, to ask people to be, get your COVID vaccine, be up to date, get your booster vaccines, and, Try and use protective measures if you are in, let's say in a crowded area, because it's coming back.
That's one disease I'm sort of tired of. I guess because unlike, say, HIV or whatever, if you're not sexually active or whatever, there's, but I mean, you have to breathe, right?
Of course.
And you have to live, so you sort of get tired of that one because you can't point your finger at somebody and say, well, you're this or you're that, the reason you have this, right? And I want to ask you this too. I look at a lot of commercials, and I'm sure you do too, you see them. Why do they always, when they're talking about the medicines, if you will, for HIV, why do they always present it as it's a gay black man's disease? To me, it calls other people, like these teenagers you talked about, young people, to think that it doesn't affect them.
Well, the reason you're going to see that, in the commercials would be that the group that's most affected would be the black man who we call,
in the closet?
Yes, you can say that, or we call it MSM, like, males who have sex with males, or,
okay.
some people call homosexuals. And so that would be the largest, class in the,
So they're the largest, but people shouldn't think that it's only them.
Oh, absolutely not.
Because then you can fall prey to this, right? Because you think it is just about them, because they never show me.
Yeah, and after that class will be black women. So, heterosexual women, black women. So it does affect everybody.
Okay, yeah, and as a matter of fact, one of the shows I did in the past about HIV, and that was one of the things we specifically talked about was women. And I'm gonna definitely bring you back in the future so we can just really break that down from, from your perspective and your expertise. But now, in wrapping this up, I want you to take it from here and just give the viewers in this last segment an overall about infectious diseases, and again, just sort of kind of, for someone who may have just tuned in at the end of the show, just take it from the top, the different diseases that we've covered today.
All right, so infectious disease is a huge, a very vast specialty. Think about every single infection we have in the world. You can't even think about it. We deal with it, we treat, to the best of our abilities. But again, I'm more focused on where we are in our community here in Memphis and what is destroying our community. And right now, it's going to be STIs, sexually transmitted infections, HIV, and syphilis, especially amongst our young people. So something I really want to be very clear, is that for parents, we need to have those talks, sit down with our kids and talk to them and see where they are. For the kids that are sexually active, you have to know your status. Get tested.
Okay, now, we're going to have a part 2, right? Because they're wrapping me up right now. Oh my God, this is so good. So hopefully we can get you back in soon.
My pleasure.
And this has been really wonderful. Okay, I would like to thank my studio guests, Dr. Animalu, for joining me today to enlighten the community regarding infectious diseases. Tune in on Fridays at 8 p.m. on Xfinity Channel 17 for more medical talk. For more information about our programming, please check us out on the web at GHS-TV.org, where we're streaming live 24 hours a day. You can also check us out on Facebook and Instagram. I'm Betty LaMarr from all of us at GHS-TV. Thank you for watching Medical Talk, and I hope to see you again.